Good afternoon, everybody. Welcome back. I say welcome back because many of the folks who are on this Zoom call with us right now were part of the COVID-19 in Context class, and I thank you all for participating in that course. It was a great experience for all of us. But today we have a special session. It's not part of the class anymore. We are very happy to welcome a representative from the Rappahannock Regional Health District, which is part of the Virginia Department of Health, to talk to us a little bit today about what's happening in the region here with COVID-19 and how we're responding to it. So before we get to that, just a few reminders and some, I guess, new information for those of you who are with us for the first time. At the bottom of your screen, you're going to see two icons down there. One says Q&A and the other one says chat. The Q&A is to ask questions to our speaker today. So as she is talking over the next half hour, if there are questions that occur to you that you'd like to pose to her during the last half hour of Q&A, please go ahead and enter those questions into the Q&A box at the bottom. Now, when the questions appear down there, the rest of us are going to see the familiar thumbs up icon. If you see a question that you like and you really want to hear that asked, go ahead and give it a thumbs up, because the questions that get the largest number of upvotes are the ones that we're going to ask first. So we want to make sure that we get those questions out there. So give them an upvote if you want to hear those asked. Now, if you have technical issues, the audio's bad, the slides aren't progressing, something's going wrong on your end, that's the chat box. Use the chat box to communicate with me and to my co-host, Dr. Anand Rao, who's going to be facilitating this with me. If you see any technical problems, go ahead and enter those in the chat box, and we'll try to get those taken care of as quickly as possible so that we can get right back on with the session. So without any further ado, I'm going to turn it over to Miss Allison Balmes-John. She's the Population Health Coordinator and the COVID-19 Public Information Officer for the Rappahannock Area Health District. And she may have a colleague of hers joining us a little later for the Q&A. But for now, we're going to turn it over to Ms. Balmes-John, who's going to give us a short presentation on the impacts on the region. Ms. Balmes-John?
All right, thank you so much. Give me just 1 second to share my screen here so we have my slides. All right, and hopefully everybody can see those. So good afternoon, everybody. Thank you for having me again. Some of you may remember me. I did a very brief presentation at the end of June on the activities of the local health district at that time, but we really appreciate this opportunity to talk more about what has been happening in the Rappahannock Area Health District. So just as an overview of what we will be discussing today, we'll start with some discussion of just who Rappahannock Area Health District is for anyone who doesn't know. Talk about some of the key indicators that we're monitoring in our community. We'll also talk about the data and trends we're seeing here locally, as well as a little bit across the state. Talk about some recent findings in COVID-19, and then a little bit about what's next and what we're kind of anticipating over the next few months here. So I promise all my slides won't be a repeat for some of you, but I do like to start with just an overview of what public health is, because we frequently see some misunderstanding there. So it's important to remember that public health is different than health care. We're focused more on protecting the health of the entire population, and we're focused a lot more on prevention. So this is in contrast to clinical professionals like doctors and nurses. They're focused a lot more on treatment after people become sick. We're focused a lot more on preventing that illness from happening in the first place. So you can imagine the role that this might play in something like COVID-19, where we're dealing with an infectious disease that's spreading in the community. We're trying to prevent it from spreading. And then surveillance and data also play a big role from the public health standpoint. The Rappahannock Area Health District is the local health department that serves the city of Fredericksburg, as well as the counties of Caroline, King George, Spotsylvania, and Stafford. So we do cover the University of Mary Washington. They fall within our jurisdiction. We are part of the Virginia Department of Health. You can think of us kind of like a local arm of that state agency. We are one of 35 health districts statewide, and we serve a population of over 370 people. So we are one of the larger districts population-wise. So with that, we'll talk a little bit more specifically about COVID-19. So we saw our first case of COVID-19 on March 8th. I still remember the day that I heard about it. We were one of the earlier districts to see a case because, as you may remember, we started to see some cases in Northern Virginia, and then it kind of made its way down a little bit. So what you'll see on this graph is all of the cases that were reported by day since March 8th. So today we had 48 cases reported. We had a high of about 130 one day. And then at the beginning of July, we were seeing some really nice trends where we actually only had about 3 new cases that were reported by day. A couple of things I will highlight when you're looking at any kind of numbers of cases reported. Remember that this is not the day that somebody's symptoms started. This is not the day that they're tested. This is the day that it's reported to the health district. So sometimes, like you'll see some of these spikes, some of those might be attributed to things like a lab really had a backlog or they had some issue with their reporting, and then they sent this rush of cases to us all at once. So we want to look at the overall trends that we're seeing in this graph. So you can see at end of May, early June, we were seeing a lot of cases. Things kind of dipped down, and we do seem to be seeing a trend that ticks back up. Where do the cases come from is a question that I know is floating around the community. So COVID-19 is a rapidly reportable disease. That means that it needs to be reported to us within 24 hours of that positive lab result. And so each of these cases represent not one positive test, but one person who has tested positive. That's how our surveillance system is set up. So I know that there's a lot of questions, maybe some conspiracy theories out there about that, but that is what this data is based on when it's tracked in the Virginia surveillance system. All right, so to dig a little bit deeper into the cases that we've seen overall, this past weekend, we surpassed a total of 3,000 cases in our health district. Keep in mind that this is cumulative, so this is every person who we know of who has tested positive since early March. You can see that these range across our 5 localities. We have seen that 9% of our cases have been hospitalized and about 1.7% have died. Also keep in mind, a lot of people experience COVID-19 as an asymptomatic disease. They're a lot less likely to be tested if they aren't showing any symptoms. And so we do assume that there are some cases out there that we're missing. So just keep that in mind, that this may not be captured. And the map down there kind of shows where RAHD falls in Virginia with some gradient change of what our case counts are looking like. I also think it's really important to consider the rates of cases. So in RAHD, we have 2 localities that are very large. Spotsylvania and Stafford are both over 100,000 people, whereas King George, Fredericksburg, and Caroline fall right around 25 to 30,000 people. I think Caroline is just over 30,000. So once we adjust these to look not at the case counts, but at the actual rates, we can see that Fredericksburg has had the most cases per 100,000 when that's adjusted. We also, this helps to correct so that you're not wondering like what on earth is happening in Spotsylvania and Stafford. This will help smooth some of that out. Fredericksburg has the highest rate. This isn't that surprising to us because Fredericksburg is the most urban area of our health district, whereas Caroline and King George, where you see a little bit lower rates, there are more rural counties. That's pretty in line with trends that we're seeing nationwide, where if you're living in an urban area, you just might have more contact with people than if you're living in a more rural area. The last thing I'll point out here is that 20 of our 50 deaths have taken place in long-term care facilities. And I think that accounts for 18 of Spotsylvania's deaths, if I'm correct. So know that when you're seeing that increase in deaths in Spotsylvania, some of that is attributed to what we've seen in long-term care facilities like nursing homes. I think we've all probably seen stories at this point that COVID-19, when it does spread in those nursing homes, it can prove to be deadly, result in some fatalities. Fortunately, a lot of our nursing homes here have been really, really great in taking the steps that they need to control that spread of disease. So I wanted to also talk a little bit about some of the key indicators that we as the health department keep in mind when we're trying to understand what's happening in our community when it comes to COVID-19. So I will present RAHD data here, but know that these same indicators are things you can think about when you're looking at statewide data, or if you live in another health district, they can also be helpful as you're thinking about the local data there. So the first thing we look at is case counts. As I mentioned, these can fluctuate a lot day to day, depending on what's happening with things like lab reporting. So again, we're looking at the trend overall. What we've seen in the last week or so is, compared to early July, in a lot more cases where we're seeing 30 and into the 40s case counts, which to us indicates that that trend is starting to creep up. Next one that we'll go into is percent positivity. This has also been in the news. I don't know if this is a term everybody had heard of until maybe May or so, but it's definitely been appearing more and more. This tells us what percent of the tests that are conducted have been positive. So the World Health Organization indicates that below 5% indicates that you're probably doing enough testing in your community. So we're looking pretty good on this indicator right now. One thing I will point out when you look at percent positivity is that you shouldn't ever really look at this one all on its own, because you have to think of it that the numerator is the total number of positive cases that you're seeing, and the denominator is the total number of tests. This number is going to fluctuate if there's truly a lot more cases in your community, or if something's happening with your testing. So always look at this one in the context of other things, but it can tell us, what testing is looking like here. And then the last indicator that we find really important to look at is hospitalizations. These have been important throughout COVID-19, because as we remember early on, there was not enough testing available. And so case counts were going up because people were finally able to get testing. But what we've been assuming is that a lot of people, probably if you need to be hospitalized, you're going to be hospitalized. So these aren't going to be quite as sensitive to that change in testing availability that's out there. The number 15 that you'll see on here, that's 15 people in the 3 hospitals in our health district that are currently hospitalized with COVID-19. Beginning in June, I think that number was above 30 or right around 30. We saw it dip down to below 10 about 2 weeks ago, and now we seem to be seeing it creep back up, but something that we're continuing to monitor. I will say we also certainly care about deaths. We do look very closely when those happen. We make sure that they're captured in our reports. But because deaths don't happen that frequently, it's a lot harder to detect really a trend in deaths. So that's why I don't necessarily list that as one of those key indicators to what's happening on a more local level. And then the last thing I'll say about hospitalizations, what we've seen in other states as they've seen increases in cases, is that hospitalizations tend to increase about 2 to 3 weeks after cases increase. So we're still in that period where we're really trying to keep an eye on what things are looking like, since we might be seeing this increase in cases here. With that, I'll shift gears a little bit. We'll talk about demographics locally. So first, we'll talk about age. This graph shows our cases by age group. And what you'll see here is that most of our cases are between the ages of, say, 20 and 49, with really that mode being 30 to 39. But then if we compare this to hospitalizations, we see that it starts to shift a little bit over, right? So now we're seeing that most of our people who are hospitalized due to COVID-19 are between the ages of, say, 40 and 69, with that mode really being 50 to 59-year-olds. I will point out with this is, once again, this is RAHD data. It does pretty closely mirror what's happening on the state level. I was kind of doing some comparison this morning. And then the last one that we'll point out is deaths. We've known, even as we've really had a lot to learn about COVID-19, that it does seem to lead to more severe cases for older adults and people with underlying medical conditions. You can really see this data starts to skew for us for older adults, even though they don't make up a very large proportion of the number of cases that we're seeing. They do make up a large number of the deaths. Also touch a little bit on race and ethnicity. This is one of the other demographic factors that's captured when we do case investigations, which is when we're asking people these questions about their age, ethnicity, gender, that sort of thing. So once again, this is our local data. We can see that our highest percent of our cases have been among the Latino community, whereas we're seeing the highest percent of deaths among the white community. But I say that with a caveat because once we start to look at the overall population of our district, we start to see some of the disparities that we've been hearing about in the news. So Latinos make up a pretty small percent of our overall population, but we're seeing that they're making up a large proportion of our overall case counts. So this is something that the local health department is really grappling with and trying to work on, doing some additional outreach to that community, expanding testing availability there so that we can start to identify these cases and isolate them, conduct contact tracing, that sort of thing. There's a lot of social factors that have been found to be tied to these case counts based on race and ethnicity. I could probably spend a whole hour talking about them, but just at the high level, know that there's social factors can range from ability to pay, your ability to access insurance, discrimination that might be out there. Well, I shouldn't say might be out there. Housing density, number of people that are living in your household. If you're living in a more densely populated household, you might be more likely to spread it to others within your family. There could be language and cultural barriers, all kinds of things. So a lot that we really, as a community, have to continue to work through, but something that we're considering at the health district as we're deciding where to target some of our outreach. I mentioned that gender is also collected. It's pretty close to 50-50 here, which is what we'd expect to see, so I didn't include that. I have gotten questions on whether things like income are available. We really don't have that data though for all of our cases. We have what is collected during case investigations, and we do not collect information on things like income. So you might be able to see that in some different samples that some studies have done, but on as far as all of our cases, that's not something that's collected. Let's talk a little bit about Virginia as a whole. I focus a lot more locally, so know that that's kind of the bulk of this presentation, but I'll try to point out some trends that we have been seeing in general. So this graph looks at the number of cases by the date of symptom onset. So this is a little different than what we started with for the local health district, where that was based on the day that cases were reported. These are by the days that somebody actually began experiencing symptoms. So maybe when their fever started, when they started developing a cough. The grayed out area shows that we don't have all of those cases yet. You know, if somebody started developing symptoms a week ago, if it took them a couple days to get tested, they may still be waiting on their results. They're not going to be captured in this graph. But regardless, we can see that we started to see this increase in cases and kind of a peak. I would say on this graph, it looks more like mid-May. Things decreased into June, and we're certainly starting to see another peak. Before this call, we were discussing that there had been over 1,500 new cases of COVID-19 reported in Virginia this morning, which would have been yesterday's data. Know that at the end of June, that was closer to 500. So we're definitely starting to see an uptick. Percent positivity, it's about 7.5% statewide, so indicating that there's some more testing that probably needs to be done so that we can continue to box this virus in. And then this map is pulled from the UVA model. This is available on the VDH website if you're interested. They update it weekly. It shows that 12 health districts are experiencing a surge in cases or a sharp increase. You also see that most of those are pretty concentrated in the eastern part of Virginia, which I think has also been pretty widely publicized in the news. And then I'll highlight the VDH regions just because they're confusing for us. So Rappahannock Area Health District falls in the northwestern region. So if you ever want to look at any of this data online, know that even though we're in the northeast part of the state, we're in the northwest region. In general, the northwest region as well as the northern region are seeing that transmission's been pretty steady, but we're seeing in the eastern region that it is pretty substantial, and actually within the last few days there's been a lot more substantial transmission in the southwest portion of the state as well. So with that, we'll shift gears a little bit to talk about some key scientific findings that are impacting public health recommendations that are out there. We all know that COVID-19 is a new virus, and I think sometimes we forget that that means that we are continuing to learn more about this every day, and we're really seeing the scientific process in action. So when I see people who are frustrated that initially we were telling people not to wear masks, and then we really changed gears, and now we're telling everyone to wear masks, that's because we've continued to learn more and more about this virus and the ways that it's transmitted. So I'll just share a few that have been, I think, especially influential within the last 2 weeks or so. This first one came from CDC, actually just released on Friday. A study was showing that recovery from COVID-19 takes a long time, even in young adults, even when you have no chronic conditions. We want to hear a lot about recovery as a community and know that, everybody who gets COVID-19 is not going to go to the hospital and it's not going to die. But it's important to keep in mind that this can still be a serious disease. So 1 in 5 previously healthy young adults weren't back to their usual health for 14 to 21 days, which is a pretty long time to think about being away from work, school, being stuck at home, and being sick. Young adults for this study was 18 to 34-year-olds. The next one we'll talk about is early last week. CDC announced a change in recommendations for isolation. So isolation is what you have to do if you are a confirmed case of COVID-19. And so this is once you get your test results, you're asked to isolate at home until you meet these certain criteria. The change last week was that now individuals who are positive need to stay at home for at least 10 days since they first began experiencing symptoms, and 24 hours have passed since they had a fever without the use of things like Tylenol, and their symptoms in general seem to be improving. This was a big shift from previous strategies that recommended testing as a way to end your isolation. So we had been seeing that businesses had been asking that people with COVID were testing positive before they can come back to work. Studies were finding that people were still testing positive up to about 3 months down the line, even when they were no longer transmitting the disease. We're really trying to shift toward this symptom-based approach. I first read this and I didn't think it was a huge change because really within the symptoms just changed the fever timeline from 72 to 24 hours. But really, if you're running a business, it is a big impact in terms of what you're asking of your employees. I was watching the baseball game last week and I heard them talking about the testing-based strategy and like wanting to scream at my TV that they need to shift to symptom-based so that we can continue going on with the season. So the fun things you get to do when you work in public health. But all of these changes have real impacts on our lives, which I think is the point I want to get across here. Next one I'll talk about was a study that came out on July 17th. This was looking at 2 hairstylists in Missouri. They both worked while they had active cases of COVID-19. And as hairstylists, they spent over 15 minutes in really close contact with their clients. Between the 2 of them, they saw 139 clients, but because they believe everyone was wearing face coverings, no clients were known to be infected. So really compelling research coming out about how beneficial even cloth homemade face coverings can be in terms of reducing transmission. And then the last one I'll highlight is about 2 weeks old now. This was some changes to the underlying medical conditions that can put someone at increased risk. So this shifted where we were able to identify, yes, these conditions are putting someone at increased risk versus some that we're unsure of. We need more data before we really understand whether or not it's going to be increasing somebody's risk. As we were starting to think about going back to school, these were really important to look at because for children who might have diabetes or a heart condition, we want them to stay home, but also for schools that are able to reopen and able to put practices in place like social distancing, we don't want to be excluding children who might otherwise be safe. So lots of different research has these really real world implications, and we're trying to translate that as the field of public health. So what's next? Research has been looking really promising that we will have a vaccine by the end of 2020 or early 2021. Lots of articles coming out in the last week or so about this if you're interested. We as the health district are starting to talk about what will this mean to carry out a really large vaccine campaign and try to get huge numbers of people vaccinated in a short amount of time. Also starting to have conversations about who do these vaccines need to go to first. But for the time being, what we're really trying to emphasize is that COVID-19 at this point is endemic, which means it's here in our community. And until we have a vaccine and have developed that herd immunity, we really need to find other ways to live with this virus, minimize the spread, and also be able to carry on our lives. So until then, I really like this term non-pharmaceutical interventions because I think it emphasizes that we can think about ways to control the spread of disease that aren't limited to vaccines and medications. So non-pharmaceutical interventions include the things that we as your local health department have been saying for many, many months now: wearing a mask, social distancing, washing your hands frequently, cleaning and disinfecting contact surfaces, staying at home if you're sick or experiencing any symptoms. Extra important to be following these steps now, especially since we're starting to see this uptick in our cases. We do see, we see a direct link between these interventions and slowing the spread of disease. I also think it's important to remember that these aren't always just up to the individual, that if you're somebody like a business owner or a supervisor, you can really help promote these. So we can tell people all day long to stay home if they're sick, but if you're supervising somebody, you also can have a big role in making sure that your employees remember this and feel supported to stay home if they are sick or if they have a confirmed case of COVID-19 when we really want them to stay there. So in the meantime, our role at the local health department continues. We keep doing case investigations. We keep doing contact tracing as we learn who our confirmed cases may have been within 6 feet of for 15 minutes or more, so we can follow up with those individuals to quarantine. We continue communicating with the public about what actions they can take to slow the spread of disease, as well as some of this new research that's coming out. We've been working a lot with special populations. I mentioned long-term care facilities earlier, but other congregate settings as well, that we want to make sure that they have the right practices in place to slow the spread of infection or prevent it from entering in the first place. And then we're working a lot on testing opportunities, especially for people who might not otherwise have access to testing due to cost, insurance, transportation, whatever it may be. So with that, I'll just point out, I know there's a lot of information out there. CDC and VDH remain really great sources of information. We also have a call center available at our health department if you have a specific question that you want to ask somebody, and my email address is there as well.